Hi guys, my name is Jacqueline Miller and today I'm going to be doing chapter 22, the respiratory system.
This is the anatomy of the upper respiratory system. The upper respiratory system is the pathway for oxygen to reach the lungs. It also cleans, moistens, and warms air. First, starting with the external nose, you have the bridge, which is the top of the nose, the apex, which is the tip, the alae are the sides, and the external nares are the nostrils. The philtrum is the groove below the nose. This is the anatomy of the nasal cavity. The function of the nasal cavity is to provide pathways for oxygen to reach the lungs. Some structures include the nasal septum, which divides nostrils. Then you have the nasal conchae, superior, middle, and inferior. These are bony structures that swirl the air you breathe. Next, you have the palate, which is the roof of the mouth. Then you have the hard palate, the soft palate, and at the end of the soft palate, you have the uvula, which is responsible for your gag reflex. Another structure is the internal nares, which is narrowing of the nose.
This is the anatomy of the paranasal sinuses, which are hollow areas in the bones and light in the skull. We have the sphenoid sinus and the frontal sinus. They also warm the air and give the voice tonal quality. Starting with the pharynx, we have the nasopharynx, oropharynx, and laryngopharynx. We also have the tonsils, which are the pharyngeal tonsils, palatine tonsils, and lingual tonsils. And the tube that intersects the nasopharynx is the auditory tube that equalizes pressure. On the underside of the larynx, we have the arytenoid cartilage, which pulls on the vocal cords to change pitch. Here we have the epiglottis, which covers the trachea when you swallow. We also have the vestibular fold, or the false vocal cords, which cover and protect the true vocal cords. The true vocal cords vibrate to make sound, and then the glottis is the entranceway into the larynx.
The function of the respiratory system is to supply the body with oxygen and remove carbon dioxide. There is 4 processes of respiration. Pulmonary respiration is moving air in and out of the lungs. External respiration is O2 in the lungs to the blood and CO2 in the blood to the lungs. Transport of respiratory gases is moving O2 and CO2 through the blood. Internal respiration is moving O2 from the blood into the tissues and CO2 from the tissues to the blood. Mucosa and the nasal cavity. Olfactory mucosa are responsible for smell receptors. There's veins just under the epithelium to warm the air. There's also lots of nerve endings. These response to irritants is to sneeze. Some important things you need to know about the trachea, which is a part of the lower respiratory system, is the histology. The adventitia is the most outer layer. The submucosa is deep to that. It has mucus glands. The third is the mucosa, which is goblet cells are produced. Some important structures of the trachea include tracheal cartilage, which keep the airway open, the trachealis muscle, which runs down the membrane portion. It contracts when you cough, and the carnea, where the 2 bronchi split. This is richly innervated. Here I've drawn the bronchial tree. First starting at the trachea, then we branch into 2 primary bronchi, then to secondary, and then tertiary. Some features of the lungs include the pleura, which is the serous membrane. You have the parietal, which lines the cavity, and you have visceral, which lines the organ. You also have the pleural cavity, which is the space in between the lungs and the walls, and pleural fluid is in the pleural cavity. In the lungs, you have 3 lobes on the right and 2 to the left, starting with the superior lobe, middle, and inferior. Next, you have the cardiac notch, which is a cutout for the heart. You have the apex, the base, and the hilum, which is an indentation for blood vessels to enter the lungs. There are 2 types of cells in the lungs. Type 1 make up the respiratory membrane, which is the air-blood barrier. This is composed of alveoli, capillary walls, and fused basal lamina. In my class, type 2 cells were very important. These are septal cells. They release surfactant and they reduce surface tension and keep the lungs from collapsing. Structural changes along the bronchial tree go from hyaline cartilage to smooth muscle as you start from the bronchus and go to the bronchiole. At the bottom, you see the tissue changes from bronchus to bronchiole. Next, we have blood supply to the lungs. For gas exchange with incoming deoxygenated blood from the heart, in my class this is very important. The pulmonary veins are O2 rich and the pulmonary arteries are O2 poor. Gas exchange takes place in the pulmonary capillaries. For systemic circulation, bronchial arteries from the aorta are O2 rich. Capillaries around the conducting passageway supply O2 to the airways. Bronchial veins go to pulmonary veins and add deoxygenated blood to oxygenated blood. The pulmonary plexus innervates the lung. The sympathetic nervous system causes bronchial dilation, and the parasympathetic nervous system causes bronchial restriction. Here we have pulmonary ventilation, which is also known as breathing. Gases flow down the pressure gradient from high to low. In Boyle's law, if the volume goes up, the pressure goes down. If the volume goes down, the pressure goes up.
Respiratory muscles include the diaphragm, which when it contracts, it goes down and increases the volume. Intercostals, which are the muscles between the ribs. And the accessory muscles, which I'm going to save us all and not say the first one. And pectoralis minor, which increases the thoracic cavity volume.
Here we have respiratory movements. The first is quiet breathing. This should be the normal. Deep breathing, shallow breathing, and forced breathing. There are 4 physical factors influencing pulmonary ventilation. The first being passageway resistance. This is affected by lumen size and constriction or dilation of the bronchioles.
The second physical factor is lung compliance. This is related to elasticity of tissue in the thoracic walls and alveolar surface tension, and decreased by diseases, tar, and blockage of bronchioles.
The third physical factor is lung elasticity. Less stretch equals less compliance.
The fourth physical factor that influences pulmonary ventilation is alveolar surface tension. Surfactants reduces surface tension. Here I have the respiratory volumes. Tidal volume is normal breathing volume. Inspiratory reserve volume is how much you can breathe in after a breath. Expiratory reserve volume is how much you can breathe out after an exhalation. And residual volumes is what is left in the lungs after ERV. Here I have the respiratory capacities. Inspiratory capacity is how much you can breathe in after a tidal exhalation. Functional residual capacity is the ERV plus the RV. The vital capacity is everything but the residual volume. And total lung capacity is everything. Here we have the pulmonary function tests, also known as a PFT. Spirometer measures the air going in and out of the lungs. Total ventilation equals minute ventilation. This is the amount of air that moves in and out of your lungs in a minute. You have forced vital capacity, where you breathe in as much as you can and out as much as you can, and you measure the gas going out. Forced expiratory volume is measuring outgoing gas over time. Dead space is inspired air that fills the respiratory passageways but does not contribute to gas exchange. Anatomical dead space is in passageway like the trachea and bronchi. Alveolar dead space occurs when alveoli are blocked. Total dead space is the sum of all non-useful volumes. Here I've written the formula for alveolar ventilation rate. This is the respiratory rate times the tidal volume minus the dead space. Some non-respiratory air movements that we do all the time include coughing, sneezing, and hiccuping. Knowing the basic properties of gases when learning gas exchange in the body can be very beneficial. The first basic property of gas is Dalton's law of partial pressures. Now this is total pressure exerted by a mixture of gases is the sum of pressures exerted independently by each gas in the mixture. Pressure exerted by each gas is its partial pressure. The second basic property of gas is Henry's law. This is when gas is in contact with the liquid, it will dissolve in the liquid due to partial pressure. The third basic property of gas is influence of hyperbaric conditions. Hyperbaric conditions are high levels of O2. This kills anaerobic bacteria because infection cannot live in the presence of high oxygen levels. It is also important to know the composition of alveolar gas. Alveoli contain more CO2, water vapor, and a lot less oxygen than the atmosphere does.
Still on gas exchanges in the body, we are now on gas exchange between blood, lungs, and tissues. There's 4 parts to external respiration. The first being partial pressure gradients and gas solubilities. The partial pressure of O2 and CO2 drive the diffusion of gases across the respiratory membrane. Next, the thickness of the respiratory membrane is about 0.5 to 1 thick, and gas exchange is very efficient. The next is surface area. Greater surface area equals more diffusion. And last, ventilation, perfusion, coupling. For optimal gas exchange, there must be a close match between ventilation and perfusion. There are 2 types of transportation for respiratory gases by blood. The first being oxygen transport. 1.5% is carried and dissolved by plasma, the other 90% by hemoglobin. Affinity of hemoglobin for oxygen. This is how tight hemoglobin grabs on to oxygen. In my class, the oxygen hemoglobin dissociation curve was very important. So, the partial pressure of oxygen goes up and the affinity goes up. Temperature goes up, affinity goes down. pH goes down, affinity goes down. Partial pressure of carbon dioxide goes up and affinity goes down. This is very important. The second type of transport is CO2 transport. It is transported as 70% bicarbonate, 20% carboaminohemoglobin, and 10% is dissolved in the plasma. The Haldane effect is when O2 levels are low, more CO2 can be carried. CO2 has an influence on blood pH. The carbonic acid bicarbonate buffer system prevents wide swings in blood's pH. In my class, when learning carbon dioxide transport, this formula was very, very important. I would recommend memorizing this for this chapter and others. There are 6 controls of respiration. First being medullary respiratory system. This controls the rhythm of your breathing. You have Pons respiratory system, which fine-tunes breathing. You have reflexes, which the nasal mucosa, you sneeze. Trachea bronchi, you cough, and bronchioles constrict. You have chemoreceptor reflexes, which respond to change in pH, partial pressure of carbon dioxide, and partial pressure of oxygen. This is very important that you know the partial pressure of carbon dioxide is the most powerful stimulus to breathe. The last 2 controls of respiration are hypothalamic controls, where this is when you breathe faster when excited or gasp when cold. Also, there's cortical controls. This is voluntary control to a certain point. These are respiratory adjustments. When you exercise, you deep breathe and use more oxygen. At high altitude, your body goes through what is called acclimatization. This is what happens when you are at high levels above sea level. Your ventilation rates go up. I thought it would be easier to combine all the clinical problems of the respiratory system together. So starting off, we have rhinitis, which is a runny nose, sinusitis, which is pressure, headache, can't drain. Laryngitis is inflammation of the larynx. You have no voice. I'm going to save us both and not say the next 2, but the first is puncture to the lungs, which ends in a collapse. Next is air in the pleural cavity that also results in lung collapse, and infant respiratory distress syndrome, which is a premature baby at 7 months old cannot produce surfactant. Continuing on with clinical problems, we have chronic obstructive pulmonary disease, COPD. Obstructive emphysema is enlargement of the alveoli and breakdown of alveolar walls. Chronic bronchitis is excess mucus production. Next, we have lung cancer. 20% of people have squamous cell carcinoma. This comes from the epithelium of the bronchi and it eats at the lungs. 40% of people have adenocarcinoma, which is mass alveolar cells in lung tissues. And 15% of people have small cell carcinoma. This comes from the lymphocytes in the bronchi. Last but not least of the clinical problems, we have hypoxia, which is low levels of oxygen to the tissue.
Now, excuse me if I say this wrong, but ischemic hypoxia, which the blood circulation has been impaired, anemic hypoxia, which there's too few red blood cells, histotoxic is where the body can't use oxygen, cyanide blocks ATP. The fourth is hypoxemic, which is less O2 in the blood. This is carbon monoxide poisoning. If you made it this far, you're halfway. Good luck, you got this.